This video is about TNM staging and treatment of endometrial carcinoma. So here it is divided into 4 stages and each stage is divided into A, B, C. So in any gynecological cancer, stage 1 means it is limited to that organ itself. So in endometrial cancer, it is limited to uterus itself, that is stage 1. Stage 1A means it is involving the endometrium or less than 50% of the myometrium. So we know it has got 3 layers, that is the endometrium, then the myometrium, then the perimetrium. So when it is involving the endometrium or less than 50% thickness of the myometrium, that is considered as stage 1A. When it is more than 50% of the myometrium involved, it is 1B. And aggressive tumor in endometrium, that is type 1C. So what is type 1, type 2 tumor? Type 1 and type 2. Okay, so type 1 is seen in the perimenopausal female. Usually she is an obese and with increased amount of estrogen. There is a pre-malignant lesion will be present and it is a very low grade and low invasive well differentiated tumor. That is type 1. Everything opposite comes in type 2. So she is a postmenopausal elderly. She is very lean. It is not related to the estrogen. There is no pre-malignant lesion. It is a high grade and highly invasive tumor. So these are the aggressive tumors. When the aggressive tumors involves only the endometrium, that is stage 1C. Stage 2A means now it is involving the cervix also. From the uterus it is going down into the cervix, that is 2A. B means more than or equal to 5 lymphovascular space invasion is there. C means aggressive tumor into the myometrium. Here for aggressive tumors there is no concept of involving a half thickness or more thickness of the myometrium. If it is involving the myometrium, it is stage 2C. Stage 3A. 3A means involving the serosa and adnexa. Here remember the adnexa means involving the fallopian tube, the ovary and the broad ligament. These three are involved in the adnexa, the fallopian tube, ovary and the broad ligament. B means parametrium, vagina, pelvic peritoneum, any of this. So we have the uterus, cervix and there is the vagina. So vagina involvement, then parametrium means either the McIntyre's ligament, that is the cardinal ligament, or the pubocervical ligament or the uterosacral ligament. These are involved in the parametrium. Then the pelvic peritoneum or the vagina, they are involved in stage 3B. C means it is mainly concentrating on the lymph node. C1 means pelvic lymph node. C2 means para-aortic lymph nodes. Stage 4. Stage 4A means bladder, rectum, that is adjacent. Pelvic organs are involved, that is stage 4A. 4B means abdoperitoneum. So remember, pelvic peritoneum is stage 3B and abdoperitoneum is stage 4B. And C means superficial inguinal lymph nodes or the distant metastasis is there. Now one exception is 1A. What is 1A? When the tumor is involving only the endometrium or less than half the thickness of the myometrium. Less than half thickness of the myometrium. That is the stage 1A. When it is accompanied with the 1 ovary involvement within that capsule. Okay. So whenever ovary is involved, it should be 3A. Right? That we have already discussed. That is the adnexa. But when only 1 ovary, that too within that capsule and 1A tumor. Now instead of 3A, it is considered as 1A only. Now coming to treatment, all the stages requires surgery. So stage 1, 2, 3, 4. Remember 3 and 4 are high grade tumor. Here we have to do the debulking. That we will do the hysterectomy, bilateral salpingo-oophorectomy, lymphadenectomy and lymph nodes are removed, the omentectomy, that all things. Whatever possible tumors we can remove, we will remove. That means debulking. Stage 1 means we will do the type 1 hysterectomy. Type 1 hysterectomy, we are removing just the uterus along with the cervix. That is type 1 hysterectomy plus bilateral salpingo-oophorectomy. So this is the treatment for stage 1. Stage 2 means we will do type 3 hysterectomy. Okay, type 3 means we will remove the uterus with the cervix. Along with that, we will remove whole of the uterosacral ligaments and the McIntyre's ligament and 1/3, upper 1/3 of the vagina. This is the type 3. So the uterus with all the ligaments and upper 1/3 of the vagina along with the bilateral salpingo-oophorectomy. That is done for stage 2. 3 and 4 debulking. And all the stages requires radiotherapy except for stage 1A and 1B. And chemohormonotherapy, that is indicated for aggressive tumors, that is 1C and 2C, and also for the stage 3 and stage 4. So that's about the endometrial carcinoma. Hope you understood and thanks for watching.